Hi friends, welcome to Nursing Skill Channel. My name is Kalayarasi. Today I am going to discuss about hypertension. First you are going to see the definition of hypertension. Hypertension is a condition of abnormally high blood pressure when the pressure in your blood vessels is too high. So due to hypertension what happened? So pressure in the blood vessels it is increased. It's called hypertension. Next, you are going to see the diagnosis of hypertension. The average of blood pressure for the healthy adult is usually about 120 by 80 millimeter of mercury. It's normal blood pressure. So mainly for hypertension patient what happen? That is systolic blood pressure of 140 millimeter or greater or diastolic blood pressure of 90 millimeter greater. So that is maximum 2 times you are checking the BP measurement during resting time. So those who are having for more than 140 by 90 millimeter of mercury, that patients you are diagnosing for hypertension patient. Next you are going to see the classification. So first one primary, that is essential hypertension. Second one for secondary hypertension. So first you are going to see the primary hypertension. So primary hypertension exact cause is unknown. Do not know the exact causes, but some of the risk factors is increasing the primary hypertension. That is age. Age mainly for elevation of blood pressure is present in approximately 50% of the people over 65 years of age. So age factors also one of the factors increasing the hypertension. So next for family history. So family history means mainly for family members also maybe they're having the hypertension. So family history also one of the factors increasing the hypertension. Next for salt intake, mainly for 7.8 grams per day. More than 7.8 grams per day intake of salt also one of the factors increasing the hypertension. Next for saturated fat. Saturated fat means what happened? Mainly for saturated fat increasing the cholesterol level and also increase the heart diseases. You try to avoid saturated fat. Next for environmental stress. Do not do enough exercises other than drinking for too much of alcohol, coffee or other caffeine drinks, etc. Next for secondary hypertension. So secondary hypertension mainly for that is due to disease condition you are getting there. Example, renal diseases, endocrine disorders, then neurological disorder such as brain tumor. Next is sleep apnea. Sleep apnea means that is medical condition in which someone stops breathing for short time during sleeping time. Okay, that is a meaning for sleep apnea. Next are then medication, example oral contraceptives, oral contraceptive pills. Next non-steroidal anti-inflammatory drugs. Next pregnancy induced hypertension. So these are the some of the disease conditions increasing the secondary hypertension. Next you are going to see the signs and symptoms. Signs and symptoms mainly for headache, altered mental status, shortness of breath, chest pain, decreased urine output, vomiting, changes in vision, dyspnea. Dyspnea means breathing difficulty, angina means chest pain. Next, palpitation. So, palpitation means that is heart is beating too quickly, not regular beating. Okay, that is the meaning for palpitation. Next, other than epistaxis. Epistaxis means nasal bleeding. So these are the some of the signs and symptoms patient is having there. So next you are going to see the management. So management mainly for reducing of salt intake. You should not take more than 5 grams per day. Next for moderate fat intake. You should not take too much of fat food. Okay, you try to avoid. Next for you try to avoid alcohol. Next mainly for obesity. patient, you try to control the weight. Next, regular exercise you are advising there. Next, other than stress, you try to control the stress level, regular physical activity, thereby reducing the body weight. Next, you try to avoid smoking. Next, lifestyle modification mainly for yoga. Do yoga and meditation, thereby you are controlling the hypertension. Next, mainly for high risk group, mainly for family history of any hypertension. Early itself you are identifying there and giving the treatment. Okay. So next for secondary prevention, mainly for secondary level, already patient is having the disease condition. You try to diagnosing the patient early stage itself. After diagnosing, you are giving the treatment. That is for secondary level prevention. So next, other than mainly for diet, eat more fruits and vegetables plus whole grains, then fish, nuts, etc. Okay, so these are the foods you take. So next, drugs, anti-hypertensive drugs is very important. Thereby you are controlling the hypertension, mainly for diuretics, beta blockers, calcium channel blocker. Next, then mainly for diuretics, loop diuretics, example furosemide, Lasix, potassium ferring diuretics, spironolactone. Next, vasodilators, example nitroglycerin. Next, sodium nitrofuranide. Next, angiotensin converting enzymes inhibitors, mainly for cunopril, etc. So you must follow correct treatment, thereby you are controlling the hypertension. Thank you so much for watching this video. Please subscribe my channel and get more videos. Thank you.